Welcome to another edition of Politics Done Right. My name is Egberto Willies, your host. Today, we're honored to have Tom Lawry. Tom Lawry is a future of healthcare expert, a leading transformation advisor, a keynote speaker, and a best-selling author. He is the author of Hacking Healthcare and the upcoming book, Healthcare Nation. The future is calling, and it's better than you think. Welcome to Politics Done Right. How you doing, Tom?
I'm doing great. It's great to be with you. Thanks for the invite.
Absolutely. So now, interestingly, I'm going to start with the entry because you're saying something that I would like to believe. You say it's better than you think. Explain.
Well, I believe America's at a crossroads and we have a choice. Look at what's happened with healthcare and the healthcare reform debate over the last couple decades, and that's one option. The option that I'm seeing is to say, we as citizens must take back our right to better health and how it's directed. So my new book, Healthcare Nation, is a positive approach to say, let's stop waiting and let's start mobilizing as citizens. Let's start looking at defining what we think should happen rather than waiting for the politicians and others to either define that or decide on our behalf. So, I think about things like healthcare today is similar to what civil rights were in the 1960s. And if you look at the history of civil rights or any movement, women's health, suffrage, people got tired of waiting for politicians and leaders to do the right thing. They started mobilizing to come up with a common vision. And when that happened, and when people mobilized in force, that's when change happens.
Now, usually whenever people mobilize in force, there has to be a catalyst. There has to be something that lead them into that. Well, we can't take anymore and we're going to do it. I think we should have been there long time ago. I think our healthcare system is a fraud, and it has been a fraud since its inception because of the way it was put together. Now, what is that catalyst for you? What do you think, based on your writings, that we ought to be doing that is different and doesn't necessarily involve politicians?
Well, again, I bring it back to little by little. It impacts everyone listening in your daily lives, whether you access and use the system or not. So America spends 3 times more than any developed country per citizen. Mm-hmm. And yet when you look at our track record, we have the worst performance on quality, on outcomes, on effectiveness, on access. 43% of Americans are un or underinsured. Our citizens among the least healthy people in the rich world and most likely to die at an early age. And I can go on and on and on, but if you look at the data, and then I'll take it a step farther, I've got a chapter in the book called What Would Martin Think?, where we look at healthcare is bad enough across all segments. When you look at healthcare and people of color in America, it's not a good story. We have serious problems that are not being addressed. They're compromising the health and well-being of so many people. Meanwhile, it's costing a lot of money. And it's like, if this were in our portfolio as a stock for our 401k, would be firing our investment broker.
You know what is interesting is that, I see that you understand the problem perfectly. I wonder, and I have this issue when I talk healthcare with a whole lot of different people, irrespective of ideology, and that is people don't want to come to the fundamental reason to why our healthcare is the way it is. And I'm going to throw something out there. I'd like you to address it the best that you think you can. I think that by design, our healthcare system is behaving exactly as it should. We don't have a healthcare system. We have a system that is designed to make profits in a capitalist society. I'm not against having a for-profit society, a capitalist society. I just don't think it belongs in healthcare because, again, it's working as it should. The efficient allocation of resources, no, but the maximization of profits for whatever service we provide, and we took that right into healthcare. Your thoughts on that?
Well, I'd go back to something you said a little earlier and back into that. You said something that reminded me of something the famed newscaster Walter Cronkite said years ago. He said, the American healthcare system is neither healthy, caring, and to your point, nor is system. So let's start there. The system, does amazing things if you get sick and you have lots of money or really good insurance. But the point to really dig deeper on, and I think you're starting to tease it out, is when you look at the American healthcare system, it does little, with those amazing things to keep most citizens healthy, well, or happy. And, let's go a bit deeper. So, the American healthcare system runs on what I call the break-fix model. So to you and your listeners, would you buy a car from a company that would only service your car once it stops running?
Oh, no.
How about a computer system that they sell to you, but the only time they'll look at it is when a virus has rendered it inoperable? That's the American healthcare system. 97% of the $4.7 trillion, which, by the way, is your money, goes to the break-fix model. They only take care of you when you're sick or ill. Meanwhile, 3% of that money goes to prevention, even though so many things like chronic conditions that RFK is talking about, with the right moves and activities, are totally preventable. So, people are doing their best to run on the economics. And one of the co-founders of Berkshire Hathaway used to have this phrase that I think applies. He said, show me the economic incentives and I'll show you the outcome. So what we have to do is start looking at, is that the way we want it? Would you rather have, more than 3% going to things like wellness and prevention that gives more citizens the opportunity to stay healthy? And then the final issue, and then I'll stop, is, America is the only developed nation where healthcare is not a right. And it's a hotly debated topic. And the simple question is, do you believe healthcare is a right? Yes or no? And if you believe, yes, it's a right, then the deeper discussion is, what should it be a right to that all citizens should have access to?
Well, let me ask you, Tom, do you believe healthcare is a right?
Well, I personally believe it's a right. The deeper discussion is right to what? Everything modern medicine can possibly provide, or a baseline of services that, if was afforded to all citizens, one, would keep them healthier. Two, it would actually lower the cost of healthcare. There's another little dirty secret in healthcare known as cost shifting, which is healthcare's economic version of whack-a-mole. So you take people who are underinsured. They wait until way too long when they're really sick, and then they present at a hospital or doctor's office. When they're provided care, the cost of that care has to be borne by someone. So the healthcare system basically takes the cost of caring for those who are uninsured, and they load it into what you pay if you have insurance, or what the businesses pay, for the cost of providing insurance. So one way or the other, whether healthcare is a right or not, we are all paying for it. And I think it would be a better discussion to say, well, if everyone had universal access, and we didn't have to shift those costs. I mean, it's very similar to what Walmart does with, they take all the theft that occurs and they basically package that, and you pay more for whatever that is. That's happening in healthcare. And the question is that the right way to run things?
No, I personally, I don't think so. I am actually a proponent of some well-designed I don't want to say Medicare for all because I have too many connotations, but healthcare for all, where we are serviced out of a general fund. I don't even know why. I think the risk pool for healthcare should be the risk pool of the country. People talk about having health insurance companies because they want to have different risk managements, and that's what they do. The only reason you have to have risk management is to make a profit, in my opinion. Well, not in my opinion. That's actually a factual statement. If we have one risk pool, and we implement exactly as you state, which is we shouldn't be spending just 3% on wellness, but we have one risk pool. And well, I tell you, better than that, why don't you give me your healthcare utopia?
Well, some of this is in my book, and I've been asked that a lot. If you look at most books on health reform, and by the way, health reform is a trigger phrase for all of those sorry conversations we've had through the decades that don't work. So I don't use that anywhere in my book. Two, in writing this book, if you look at the books written on fixing healthcare, they follow a pattern of first, trash to throw out all the stats for why it's bad, and there are plenty of those. And then most books then go on to blame someone. It's big pharma, it's the greedy doctors, it's fill in the blank. And then the third and final thing is that all that is a setup for the, quote, expert to then tell everyone else what we should do to fix it. I've got my view, I'll give it. But part of this, to me, is mobilizing to say, as citizens, let's stop being disempowered by having others tell us, and let's start looking at how each of us can define the future we want. Because once again, it's your health, it's the health of your children, and it's your money. So my view, and I tee it up in the book, is, it's crazy to spend 97% of our money on break fix and 3% on preventive services. And so, for example, 30 million Americans die each year prematurely from preventable diseases. I mean, think about that. We probably all know someone who died early from something that was preventable. 27% of the U.S. healthcare spending right now goes to managing those medical conditions once they're sick that are totally preventable. So if I were the Grand Czar, I would start saying, this is crazy. Let's start putting more money into things like prevention, things like wellness, other things, because you mentioned risk pools. And part of this is, how do we define health and health care, and how do we find it differently? So let me pose another question. When it comes to predicting the health of an individual or a population, which is a better predictor, your genetic code or your zip code? And
your zip code.
They're both important, but I bing, bing, bing. Yep. You just won the prize. We often talk about, in the break fix model, risk pools and other things. And if we look at things like what we know as social determinants of health, to say, there's a reason vulnerable populations are more likely to be obese than those who are not. And typically it's, they live in places where there's little access to healthy food. There are food deserts. There are few places that are safe to walk. So when we talk about health and reimagining, I'm encouraging people to think very broadly. Or the other thing that has come up just in the last few months, and anyone from California knows this, is like, is environmental policy the same as health policy? Because I look at what's happening in Southern California, whether it's the immediate effects of those fires, the amount of pollution that then gets spread around the world, affecting people with things like pulmonary and asthma. As we think about reimagining health, should things like social determinants be part of it? Should things like our environmental policies be part of it? And my belief is, yes, those holistically add up to keeping people healthier. We still need a system that takes care of those of us when we get sick or ill. But imagine starting to do more to give everyone the opportunity. They may not take advantage of it, everyone the opportunity to be healthier.
That is so important, and I'm glad that you connected all those dots together. Now, look, before I go, I always ask a very important question, because we don't want you to just come and tell us everything about your book. We want people to get that book and be able to be nourished by the book. I didn't read the book. I read the table of contents, and I skimmed through. I have to go through a whole lot of those, and I must say that I'm very impressed. And it is something that I hope people would go out and get, because it's altogether a different paradigm that we should be aware of and that we should do something about. So I always ask this as the last question, and that is, what should I have asked you that I didn't, and what would you like the audience to know? And take as much time as you need.
Well, I think you've done an outstanding job of asking questions in the time we have. So bonus points aside, I can't think of anything there. The book Healthcare Nation, it officially launches March 28th, all major booksellers. And I guess what I'd say is this, it's back to, we're talking about our health. We're talking about our future, our children's future. And for anyone who says, it can't be done, I can't do anything to change it, I would just say, look at the trajectory we're on, which is we're heading for disaster. So I bring it back to, we all have the power to have a view, to be educated, and then to do something to act on it. And I start the book in my preface, and my editor told me it was really a horrible way to try and sell a book by starting with this story. But I start the whole book by telling the story of Rosa Parks and saying, I wonder what Rosa Parks had for breakfast the day she made history. I mean, did she sit there and just think it was going to be an ordinary day, or was she staring into a coffee cup planning something? But, when you look at the story of Rosa Parks, that one action started a movement. It was the flashpoint. And my whole point is we need a Rosa Parks moment for healthcare, and we need it soon.
Well, Tom, I think we are in that moment right now, especially now with what's happening from budget cuts to just about everything. So, Tom Lawry, I really appreciate you coming on to Politics Done Right. Folks, don't forget the name of the new book. First of all, I want you to check out Hacking Healthcare. But the new book that's going to be launched on the 28th is Healthcare Nation. The future is calling, and it's better than you think. And that's what got me. It's better than you think. It's hopeful. It is hopeful. And what we want is hope with grassroots action. I think Tom Lawry has the pill for that. Tom Lawry, thank you so kindly for having been on Politics Done Right.
Pleasure. Thanks for having me on.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.